I'm at REIT Week 2010 in Chicago, and I'm joined by Frank Spencer, President and CEO of Cogdell Spencer. So you focus on the specified niche of medical office buildings. Given everything that's going on with healthcare reform, what is your outlook for the sector?
We're very positive at this point. Really, healthcare reform is just an incremental on vectors that are already underway. If you think about the trends of the last 20 years, technology, cost, patient convenience, all of those are pushing towards an outpatient delivery system. That's where we specialize in the facilities. So with healthcare reform, you're going to have more people insured. That's going to drive more people to primary care. And so we see it as incrementally positive, but those other trends are really overwhelmingly creating the move to outpatient services. So we're happy about healthcare reform, but it's not a game changer for us.
And in your tenure, speaking of game changing, you've turned the company from a small regional player into really a national operation. What do you think was the key decision that you made in that journey?
There's no question that the key decision for us was becoming a public company. The access to capital fundamentally changes your strategic alternatives. When you're a small private company, or really any private company, you're limited because you're deciding each deal how to finance it. When you get the public access to capital, or the access to public capital, you have the ability to really look more broadly. That enabled us 2 years ago to acquire Marshall Erdman, becoming the largest healthcare design build company in the country, and now with offices coast to coast. Absent that capital, that isn't possible for a company like we were as a privately held partnership.
Mm-hmm. And you recently announced plans to step down in October. How is the succession plan going, and what do you think is the key to making that transition smooth?
I'm excited about bringing in new talent to join an already terrific team. One of the reasons I was comfortable stepping down was that we have a team of experts in place who I believe are the best in the industry. So the key to the transition is going to be my staying around. I'm on the board. I'm committed to making whoever sits in the chair successful, and he or she is going to have the greatest opportunity to work with the best team in healthcare real estate.
And other than issues about the succession, what's the most common question that you're getting from investors here at REIT Week?
I think investors are very interested in our integrated delivery process, because what we're able to do, because we have strategy, architecture, engineering, construction, and the whole value chain. When we deploy capital, we capture the profit of that whole value chain for our shareholders. So if you look at the 4 projects that we've announced over the last 3 quarters as opening, they add 6 to 10% of our NOI portfolio wide. Well, that's an incredible internal growth mechanism. And so the question we're being asked is, can you do more of those projects? And the answer is yes.
Well, good luck with everything. Good luck with the succession plan.
Thank you.
For REIT.com, I'm Matt Bishar.